Check out this super incredible pictorial of the uterus. Now it's showing blood vessels that are giving the supply to the uterus and the ovaries and the various organs in the pelvis. But what's important to recognize is these vessels are actually inside the tissue. They're just showing them on the surface. They're not actually right there. Interestingly, the richer the blood supply obviously shows that a healthy uterus exists there and healthy organs, but sometimes you can have too many. When you have too many blood vessels, you can have lower implantation, lower chance of having a safe pregnancy, higher complication rates, and as well have problems like bleeding at the time of delivery. You also might get some patients that have pain with intercourse or very heavy periods if they have too many blood vessels. The other interesting thing to note is the blood supply that's shared between the ovaries and the uterus, which shows you that some of the hormones that the ovaries are producing travel directly from the ovary into the uterus, while some of them go into your blood supply. A great example of this is progesterone, and that's why you need double progesterone, because the blood supply is picking it up from the ovary and going right to the uterus, but some of it's also going into your system. That's why you need vaginal, which will mimic the direct blood supply, and the injectable, which mimics the going into your blood vessel supply. So very, very cool pictorial showing what can happen with blood vessels in the uterus if things are going right and if things are going wrong.